I'm joined now by Dr. Asheesh Bedi, team physician for the Chicago Bears and the executive medical director for the NBA Players Association. Thanks for spending a few minutes with me, Dr. Bedi.
Thanks, Stephania.
Can you explain for us what the AutoCart technique is and how it's changing the standard of care when it comes to cartilage restoration?
Yeah, AutoCart is a minimally invasive arthroscopic procedure where we're able to harvest the athlete's own cartilage cells or chondrocytes and deliver it back to them together with the scaffold and growth factors in platelet-rich plasma to treat cartilage defects throughout joints in the body.
And how does the AutoCart technique differ from the more traditional cartilage restoration procedure?
Yeah, AutoCart's been a big transformation for me. Prior cell-based approaches where we would take cartilage cells from the patient and give them back was always 2 stages. You'd have to harvest the cells and then another day come back to finish the treatment. That's inconvenient for athletes. It's more time, it's more recovery, it's more invasive. AutoCart has changed that game by allowing you to do all of that in a single setting. And so when you identify cartilage problems, sometimes incidentally at the time of surgery, you can treat them efficiently that day with their own cells.